Hi, my name is Sony Singh, and we're coming to you from CanSAGE, the Canadian Society for the Advancement of Gynecologic Excellence. I'm here with Professor Geoffrey Cundiff, who's the head of the department at UBC, and he was one of our plenary session speakers. Thank you for joining us today.
Oh, my pleasure.
Jeff, you spoke on probably one of the most important issues regarding surgical training or education today, and that is, how do we do it better? Can you just give us some ideas as to why it's even important to talk about surgical education today?
Well, there's no faster way to excellence in gynecologic surgery than through education. Really, the next generation, we need to make sure that they are optimally trained, and we need to do it in a way that's efficient and really easy for them to learn without making it difficult.
So one of the most profound things that you mentioned is when we teach surgeons, we always think about teaching stitching or using your hands to cut tissue, but you said that it was more than motor skills. What do you mean by that?
Well, obviously motor skills are very important, and within motor skills it's important that we try to develop some of the key motor skills outside the OR. But there is much more to being a good surgeon than just motor skills. Anatomy is an essential element, and that's an element that has really suffered in recent years. So making sure that we teach anatomy is, I think, the foundation. But there's many other things that make up a good surgeon: surgical judgment and the ability to lead a team. And those are more difficult to teach. They're not as easy to evaluate as motor skills, and so they tend to be neglected.
So it's interesting. So you talked about anatomy, doing the skills, doing the procedure, but leadership as well as judgment. And so I think when we think of surgeons, we just think of them doing a task, but that bigger picture was what was most profound. Are there things that we can do better as surgical teachers? Or do you have a couple of examples that we can implement in our practice?
I think it's important we have adult learners here, and to really focus on what they think is their most important goal for the day. So that's what I start with. At the scrub sink, I ask them, what's your goal for today in terms of an educational goal? And I try to focus my teaching on that goal. And that helps me to balance the needs of the patient and the learner as well. The fact is, we need to recognize that they don't have the unconscious recognition of cues when things are going awry. And as expert surgeons, we've developed this subconsciously where we can see when there's a chance to have a mistake that could lead to a cascade of events. And helping them develop that consciously, I think, is probably the best way that we can develop surgical judgment without having to learn that the hard way.
This is great, and I think the point and the reason we have you here is to really understand that we need to develop better surgeons in the future, and thanks to you, hopefully we will. Thank you for being with us.
My pleasure.